Hi Nancy, I'm Alyssa. Brennan, I'm
Hi.
going to be your physical therapist today. So I know that you have diabetes and peripheral neuropathy. So first I'm just going to go through a diabetic foot exam with you. And your physician should be doing this every time you go to the doctor. So can I just have you take off your socks first?
Okay.
Alright, and I'm going to take your foot. So the first part of the exam is observation. So I'm just going to look on the top of your foot and at the bottom of your foot. And basically what I'm looking for is any ulcers or cracking or corns or calluses, things like that, and broken toenails. And then I'm going to look between each toe individually and look for those same type of things. And that foot looks very good. And now I'm going to have to do the other one. So, looking at the top, between each toe. And the bottom. And it all looks good. So, I'm also, I'm going to use your sock, please. Alright, so, yep, that's fine. So basically you need to make sure you're wearing white socks. And all I'm looking for is any type of drainage on your socks. And there is none, so you can be looking for that. And so I'm going to have you put your socks on, and I'm going to have you put on your shoes really quickly. And when I'm looking at your shoes, I'm going to be looking for the wear pattern, the fit, and the support of your shoes. So have you just put, you could just put one on is fine. Alright, and the fit looks pretty good, and your support looks nice. Alright, so I think it's good. You can take it back off, and then I'll look at the wear pattern on it. So, it looks alright, so thank you. Okay, next I'm going to have you take your sock off again, and I'm going to look for circulation in your feet, so I'm going to look for, I'm going to feel your pulse. So I'm going to feel for your dorsalis pedis pulse. Just make sure you can feel it and it's normal feeling. Okay, good. And now I'll feel your other one. Good. And also for circulation, I'm going to feel for temperature. So you should always use the back of your hands. So I'm just going to use the back of my hands to feel for temperature. Good. And I'm also going to look at the hair growth on your legs, which looks normal. Okay. Very good. Okay, so now I'm going to test your sensation in your feet, because a lot of people with peripheral neuropathy have a loss of sensation in their feet. So what I'm going to do is I'm going to have you give me your foot, and I'm going to have you close your eyes, and when I'm going to use this, and if you can feel me touching with you, every time you feel me touching, I want you to say yes, okay?
Okay.
Go ahead and close your eyes, and then every time you feel it, say yes.
Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes.
Good. Very good. And now I'll take your other foot.
Yes. 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 Yes.
Good. Okay, and you can also, other types of sensation you could do would be vibration or light touch. So that's the end of our diabetic foot exam, and like I said before, you should have your physician do that every visit. And also, you yourself should be inspecting your feet daily. So, basically, to inspect your feet, you want to do the same thing that I was doing before. So if you can pull your foot up, you can look at the bottom and between each toe, and then inspect the top of your foot, look at your toenails, looking for the same thing that I was looking for: calluses, corns, broken toenails, all that kind of stuff. Or if you cannot get your foot up, you can use a mirror And you can put a mirror on the floor to inspect your foot, or there's these mirrors that have a long pole that you can hold on that have mirrors that you can move around. Or in this case, we can use a phone. So you can put your phone on the ground, so the camera is like facing at you, and then you could lift your foot up and like above it, and so you can see the bottom of your foot.
Okay.
So good. So we're looking for the same type of thing. So then, also when you clean and wash your feet, the water temperature should be between 90 and 95 degrees. And when you should moisturize your feet using like some kind of moisturizer or lotion, but you need to make sure it does not have alcohol in it. That's important. And so regularly clipping your toenails is very important, and using like a pumice stone for calluses. Okay. So very important. And things that you should avoid: high heels, using heating pads on your feet, and some things to consider would be wearing socks at night, wearing sunscreen on your feet. You should avoid also crossing your legs, because that cuts off circulation, along with tight socks or tight clothing that also can cut off circulation. And something that is very important is exercise, because exercise is going to help increase your blood flow. So I think that's all that we have today. Thank you very much for letting me work with you.
Thank you.